And the safety of other pain medications being questioned in Washington. What do you do for people who are in pain? Dr. Bruce is here now to offer some alternatives. Dr. Bruce.
Well, Colleen, the answer is simple. Don't worry. Don't stop any medicines you're on your own. There are still many safe choices. When Vioxx was taken off the market, many people panicked.
Patients were concerned as to whether or not there would be a drug that would be comparable, that would give them the same relief.
Some, like Diane McCloskey, who suffers from knee pain, were so frightened to hear a drug they thought was safe was really dangerous, decided to avoid all future risks.
I'm not taking anything right now, and I'm spending some sleepless nights.
Diane's orthopedist told her that's not necessary. There are many safe choices.
The options would include other medications in the same category, which are Celebrex or Bextra, and then there's Mobic.
You have many different options, but you need to keep one thing in mind. Both Bextra and Celebrex are in the same class of drugs as Vioxx. Mobic is slightly different. It blocks two pain enzymes instead of the one that Vioxx, Bextra, and Celebrex work on. Now, Mobic, Celebrex, and Bextra have all been on the market for a while, and many doctors feel comfortable prescribing them.
If they haven't had any episodes of any cardiac involvement, then they're going to be safe.
But since we did not know about Vioxx's dangers until years after its release, many patients prefer the more conventional type.
I would use the more traditional anti-inflammatories such as Ibuprofen or Motrin, Aleve.
While each of those work, you must remember that they may increase the risk of irritation and bleeding in the stomach. Vioxx, Celebrex, Bextra, and Mobic were created to reduce that risk. While the events surrounding Vioxx make it clear more study is needed on each of these, one piece of advice is clear.
Don't panic. There are other drugs, there are other options out there that will give you the same relief.
And the exact choice, it depends on your history and your condition. What works for one person may not work for the other. You still have at least 10 choices. If one doesn't work, try another and ask your doctor which is right for you.